When you look at the horse skull, the upper teeth are wider than the bottom teeth. So they stick out a little bit. They have ridges that go down the side of the tooth there. So whenever they chew like this, these points are formed at the end of these ridges because they don't get wore off because the upper teeth are wider than the bottom teeth. So they'll have these points that'll form at the end of these ridges here on the upper outside. And that'll also happen here on the lower inside mainly. Like that. Whenever they're eating, the tongue is sitting here pushing feed sideways. Your cheek tissue is pushing it back in. So you're going to get sores, irritation up in the cheek tissue, up in the upper outside, up through here. And the tongue, since it's rolled over on these points, you're going to get some abrasions on
Cutting on the
tongue.
inside.
Yep. You can see it down through here. So it's real important. Most of the time when people talk about floating their teeth, they're going in and knocking these points off right here.
Yeah.
Real important to get these ridges down at the same time you take the points off. If you take the ridges down, your points come off. If you just go in and knock these points off,
It'll only help for a short time.
yeah, about 3 or 4 months you'll have points back again.
That
So it's
quick.
real important to get these ridges down. And to do that, the arcade is not straight back. It's kind of at an angle like this.
Yeah.
So
I see that.
if you go into the side right here, you can't really get all the way to the back if you go in straight like this. You really need to come up from the bottom, so you're actually approaching the ridges from the bottom, so you get these ridges down.
Okay.
Take the ridges down, your points come off. Okay? So we're basically making them more comfortable. When these guys chew, the tongue goes back and forth here, and it's like a big assembly line that goes back through here. It's like a big auger. The tongue's pushing out, cheek's pushing it back in. So you're trying to make them more comfortable so your auger system or your assembly line works good. Okay? These teeth, there's 6 pair of teeth over here. These teeth should line up like this skull is. Should line up perfectly straight. That way everything's level through here. Sometimes you'll get these teeth that'll be sideways like this. So if they're a little crooked, you won't get this nice even wear, and it'll get points come out even on the bottom outside and the upper inside. So you really should be concentrated with your points, but also both sides of the teeth here. Okay, so we're doing that to make them more comfortable. These teeth are about 4 or 5 inches long. You can see the root system goes way up in the sinuses.
Wow, it is tall.
You're just seeing about 1/4 of the tooth right here. These teeth here come all the way down. These are the only teeth that the horses have. They do not grow. So what happens on these is they're sitting there and wearing, and as they wear off, that tooth will migrate down about 1/8 of an inch per year. Okay? So we want these to be level and be sure that they're wearing evenly. As they get a little older, you'll have some of the teeth, the texture of the teeth will change where they get softer. So if you have a tooth where the texture is changed and the tooth is softer, the opposing tooth will wear it down too fast, and you get kind of a roller coaster going. It's called a wave complex. So when we look in here, we're going to be sure that everything is level. If we find a high tooth here somewhere, we'll take it down and get the pressure off the opposing tooth. That way they come through evenly, and they wear evenly, and they last a long time.
Now, what causes a tooth to be soft?
It's just a change in it's just a texture. It's a calcium texture. It's genetics. A lot of it's genetics. You know, some people have good teeth and they wear better. They don't have any cavities. Well, it's the same in horses. The anatomy and the texture is all genetics. Yeah.
Okay.
Yeah. So we're going to be sure that we make them comfortable. Make sure that everything's wearing evenly there, so they wear evenly and your teeth last longer. These are the bars right up here, the bars of the mouth. Your cheek tissue will be right in here. So your bit is going to lay right in here on your tongue and your bars with your cheek tissue here. When you engage your bit, it's going to push your tongue back against this part of the mouth. It's going to push your cheek tissue back up against this part of the mouth here.
Okay.
You can see if you've got some sharp edges, this is called a wolf tooth.
Yeah.
If you got all this going on, you can see how you can run into some. It'd be very uncomfortable. Yeah. So we get the wolf teeth out, and we're going to clean this part of the mouth up. This side I've done. You can see the difference.
Okay.
Got the wolf tooth out. We just clean up this part of the tooth here. Those are called bit seats.
Okay.
Upper bit seat, lower bit seat. It's kind of misnomer because your bit never hits this.
Never hits it, but
push
it
your
clears
cheek
the
tissue.
way for it.
It's like putting a little power steering in there. but when you engage your bit, you've got a nice place for your cheek and your tongue to rest.
And no discomfort
Yes.
occurs.
Okay. Yep. Like I said, these are wolf teeth. All horses have wolf teeth. The boys and the girls, they usually get these by the time they're 6, 8 months. We like to take the wolf teeth out, put a bit seat in here, actually before you do a whole lot of bridle work with colts, because they're going
Yeah.
to end up with some bad habits sometimes. So we try to get the wolf teeth out and get them cleaned up in here before you put a bit in their mouth, okay? This is a side here, this is a before and an
Yes,
after.
and after.
Here we've got the ridges off, got the points off, cleaned up back in here. You can see on this side how sharp they get a lot of pitching back in here.
Oh,
Okay.
yes.
Yep, so you can see here how we've cleaned everything up, got the ridges down, got everything cleaned up. We don't bother the grinding surface here unless there's a high place we need to reduce,
Okay.
like I was talking earlier, because
Here's
you want
weight.
this to be rough and flat so they can grind good.
Because that makes it grind.
Yep.
Yes.
Going up forward here, these are the canines. Usually just the boys get canines. Mares don't usually have canines.
Okay.
A lot of people get the canines confused with the wolf teeth. They'll
Yeah.
call in and say, well, my old horse still has his wolf teeth. Well, they're actually the canines. These are the fighting teeth out in the wild.
Oh, okay.
They're also called bridle teeth. The canines are bridle teeth. They come in about 4 years of age. They have a long root system. Can't take these out like we take these out, but we do keep these reduced. Sometimes when you're putting your bridle on and taking your bridle off, they'll throw their head
Okay.
up and the mouthpiece is hitting these canines, and that's causing them to be a little uncomfortable. So we do take those down,
Round them.
reduce them down, yeah. We usually keep them about the same height as your canine, as your corner incisors right here, like that. Mares don't usually have these. If they do, they're usually smaller, but they don't usually have these. All horses get the
Wolf
wolf
tooth.
teeth, but really have to get the wolf teeth out before you can put your bit seat in. You see?
Yes, I
Yeah.
see that, yes.
These come in about 4 years of age here on your geldings and your stallions. These are incisors. This is what they hold the grass with their lips and their teeth and cut grass off with.
Cutting edge.
Yep. If you look back here in the molars and the premolars, there's an angle here. All horses
Yeah.
have their normal angle, okay? The reason that the uppers are wider than the bottoms is so these points will form out in the wild. You want these sharp points, okay? The reason your angle's there is when they go up the angle, when they occlude, when they go up that angle, that's where you get your pressure to grind.
Okay.
Okay, so you want to leave that normal, natural angle there. Now, for these to come together here,
You were saying in the wild you want the points?
yeah,
Why is that?
because
Why
they're
is-
eating rocks and brush and grit and everything else they can find, so they're eating rougher stuff, so they need to be able to chew it up more.
Oh, okay,
And out in
so
the
that-
wild, they keep those wore down.
From
more.
the roughage?
Yeah.
But, okay.
Yep.
But
But
in-
horses are browsers, so
Yeah.
out Mustangs and everything, they eat trees, whatever they can find, so you need all this here. Yeah, then Mother
But in
Nature's.
domestication, we
Yeah.
don't, they are not necessary to
Yeah,
chew the
exactly
roughage.
right. Yep. So Mother Nature's fixed that where those points will recur. If they wear them off, they keep.
come back.
Yeah, But for these to come together here and grind, these have to separate up here, okay?
Okay, yeah,
So
I see that.
it's real common, if these are too long, see, these can't get together.
They won't grind.
So it's real common as they get older, these teeth are straight up and down naturally, pretty much.
Yes.
As they get older, they change and they'll contour out like this, get a little longer in the tooth, not as much pressure here, so these front teeth tend to get a little too long, okay? Instead of being straight
Okay.
across, they'll kind of smile at you a little too long. So we'll take these down, it's called an incisor reduction, but we'll take these down. When these occlude here, you should be getting some separation.
Okay. And
Yeah.
if those are too long, it's going to be causing
Yeah, it won't let these come
problems in
together.
chewing.
So older horses, we see a lot of old pot-bellied thin horses. What it is, their teeth are too long, they're not digesting their feed good, and they're still getting roughage in there, but it's not digesting good enough to digest. So a lot of that's because they haven't chewed it up good, and a lot of it is from their front teeth are too long. Okay. When they're youngsters, when they're born, they have the first 3 sets of premolars up here.
Okay.
As they get older, when they're about a year old, they get their first molar. Around 2, 2.5, they get the next molar, and around 4, they get the last molar in. So these are all baby teeth. The last three are all permanent teeth.
Okay.
All of these are baby teeth. So they start losing these teeth as they get a little older. Between 2 and 4 years of age is when they lose most of these, 2 and 4.5. But they lose in a set of 4s, 2 on top, 2 on the bottom. They usually lose the first set back here. These are called caps when they come off the baby teeth. They'll lose these around 2.5. Next set around 3. This set around 3.5. They'll lose this set up here, 2 on top, 2 on the bottom. Thank you. At 2.5, 3.5, 4.5. So they're either losing all of these in these first 3 sets here. They're either losing all of those, or they're all coming in between 2.5 and 4.5. They're either gaining or losing 48 teeth.
A lot.
A lot going on. Real
Yeah.
dynamic time on these 2, 3-year-old
Yeah.
horses like that. So a lot of 2 and 3-year-olds will do cap checks on the futurity colts and show horses and things they're using quite a bit. We'll do cap checks and make sure everything's come off, make sure everything's
Coming out and
doing what they're supposed to.
replacing correctly.
And sometimes they'll come part of the way off like hangnails.
Yeah.
Need to get them on off of there, and then also when the permanents come in, they're razor sharp. So you might go in and put some nice bit seats in your 2-year-olds, and then with 2.5, 3, they got brand new teeth. You have to do them again. You know, so we're concerned about making the teeth, the chewing process comfortable for the horse, so they can grind efficiently, so the auger system works good. We're concerned about them being comfortable in the bit when you're riding them. We're concerned about everything being balanced and wearing evenly, so they're hitting on all 8 cylinders. Also on youngsters on the caps. Old horses, a whole new ball game, and I've seen a lot of geriatric horses this last 2 weeks, it seems like. But they start losing these teeth. The teeth start wearing out. Sometimes if they lose a tooth and you don't have another one in apposition, that tooth, the
Grows
good
up
tooth,
way
will
too
grow
far.
up in there and gets interfered with. A lot of these teeth the root system will turn loose. You'll have a loose tooth, but it still won't come out, and it'll be like a hangnail, so we have to take those out. A lot of stuff on geriatrics, do lots of old horses. Most of those you can improve and fix like that.
So in the case of the one being lost on top, say, and the bottom one growing up, do you just have to keep grinding it down?
Yeah, just keep reducing it down to where it doesn't get in the way. And usually those, once a year, you can go in and balance them out and clean all that up. Yeah. Yep. Sometimes they may only have half of their teeth or less left, but you have to fix it where they can use the other half good.
Whatever is left.
Yeah.
Yeah.
We sedate these guys, put a mouth speculum in here. This is a TMJ joint, so we want everything relaxed so we can open the mouth up and not put any pressure on the joint, make sure the tongue's nice and quiet. Put a little analgesic in there, a little painkiller in case we have to remove a tooth or anything like that, so we do get them relaxed.
Yeah.
Yep.
Could you explain the age in the front teeth?
Oh, yeah, this is a good one to tell on. This is a,
See if I can get up here and see that.
yeah.
Okay.
When you look at this particular one, you can see these little dark places down inside the tooth.
Yes.
Those are called cups.
Cups.
You can see how the cups are gone on this particular tooth, these teeth. They're about halfway wore out here, and then they're present out here. They lose these cups as they get a little older. They'll lose this pair at 6, 7, 8. Then you come up here 9, 10, 11. So this is a 6, probably a 7-year-old, about half wore out. But that's a good way of looking at it on this particular skull, because you can see the cups really good here. So this would be a 6. I'd call this a 7-year-old horse.
7-year-old. Okay.
Yeah, by looking
Now,
at the cups.
I've heard that they're after cups are supposed to be stars. That you can see.
Yeah. Actually, right in, see that? This is
That's
kind of
the beginning of the
Yep.
star.
Yeah. See this darkness right here a little bit?
Okay,
That's where your
yeah.
cup was, and then right behind is the star coming in.
Behind it.
Uh-huh.
Okay.
See that? And then as that comes on up, this will go away, and then you'll see just a star.
Okay.
You might see some today.
Okay.
Yes, should.
Yep.
Yes.
Can you see the top teeth? Upper there.
Yeah. See, they're
They're
all
all cupped.
mostly all the cups are
Big
there.
dark cups, yeah.
Okay.
And even though the top 2 front teeth and the bottom 2 front teeth come in at the same time, they wear out 3 years differently.
Yes. Yep.
That is interesting.
Well, the cups wear down. Yeah. Yeah.
The cups wear.
Yeah.
Well,
So,
that was good.
but that's kind of a quick
Excellent, thank you.
So